views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure today to have Dr. Jerry Chao, attending anesthesiologist and Associate Professor in Anesthesiology at Montefiore-Einstein. Jerry, welcome to the program.
Thank you so much, Dr. Latimer. So happy to be here today.
So, Jerry, I know you're doing some cutting-edge research on pediatric anesthesiology, which is so important. Tell us a little bit about the research you're doing.
Thank you so much. In my clinical practice, I have the privilege of taking care of infants and small children every day who require some form of a procedure or some study, like an MRI, for example, that requires them to either be still or not feel any pain, just as in adults as well. And so for these procedures on these young children, we administer all different types of anesthesia. We have the privilege of working with families and other staff members in the hospital at Montefiore to care for these young children. One of the concerns is what the early anesthetic effects are on very small children. And that essentially is what my research is intending to help clarify. We simply want to understand better how the early anesthesia works, what its effects are, and how its mechanisms of action are in the brain of very young children. We want to understand better what the effects are to just improve the clinical practice, to increase our understanding. And hopefully in the long term, with increased understanding, we can make the anesthesia better for children.
So I can imagine that at least a couple of the questions are, you need to have a young child be out during a procedure, but then what are the short and long-term effects on cognition and other kinds of things? That would be my guess, that those are the things you're looking at. Tell us about what is your research focusing on?
Absolutely. That's one of the big concerns, as well as just in general that children understandably are understudied compared to adults. They are unable to consent for studies. It's more difficult technically. But essentially what we're doing is we are measuring the brain activity during the anesthesia exposure. And this could be general anesthesia, this could be regional anesthesia. And we're studying how the brain effects are of the anesthetic. And we do this by recording what are called the brain waves of the young patients. It's the underlying activity that's occurring in the brain. A more scientific term describing what we're doing is we're measuring the electroencephalogram. It's essentially a series of electrodes that are placed at various parts of the head. And with it, it is able to measure what's happening underneath, the electrical activity or the brain waves in these very small babies in a way that is completely non-invasive, in a way that is safe and that doesn't hurt or harm the babies at all.
What's the age range?
So we've been recruiting patients as young as premature babies that are just a few days old, to infants and children that are maybe 2 to 3 years of age. And so right now, the median age of our cohort, which we've been building since 2016, it's about 7 months. So small infants, less than a year of age,
Got
7
it.
months.
So they need surgery that is life-saving. So let's just say that out loud. That said, what research is there, or look, you're studying something that sounds fairly complicated and probably has a fair degree of challenge. What data are out there that map on the EEG or other measurements you're doing to longer term cognitive outcomes? In other words, how do we know that those measures make sense? Is that a fair question?
That is truly a fair question and a very crucial and important question, Dr. Latimer, which is what is the clinical meaningfulness? What is the relevance of these measurements to issues that matter to families, to parents? And that's an excellent question. And the answer essentially is the data is continuing to be built and amassed. Since we started this work in 2016, we have now to date recorded in over 150 infants. And so us, along with some other groups in the world that are collecting this data, the hope is we are amassing sort of a larger critical mass of data, if you will, upon which we can do some pretty granular deep dive analyses. And then to your point, Dr. Latimer, the follow-up, any long-term follow-up that might be possible, months, years, even decades down the line from these brainwave measurements. That'll be sort of the next stage, the next phase of our studies. The studies to date in the past have looked at outcomes, but the exposure data, if you will, so what is happening in the brain, it's been limited. We're one of the first to look at very granular brainwave data, but the disadvantages of that approach is it takes time as the children age, as the subjects age, to be able to study them, to link them to the outcomes that you referenced. And so, very excitingly, we started in 2016. And so now these children are aging into some assessments that we are planning on doing. And so hopefully we can demonstrate some associations based upon some of the preliminary data from other groups that have shown, that there are certain assessments that might be relevant or worthwhile to look at.
So you mentioned regional versus general. Is it too soon to tell, depending on procedure, what best practices are out there, or is it just too soon? We don't know yet.
Right. I think it may be too soon. So general anesthesia, it's very safe. It's a long track record of safety. Whenever possible, if we can supplement by giving nerve blocks, by trying to control pain regionally, it's helpful because it decreases the burden of the dosing of the general anesthesia. So it's kind of like using, all of the tools in our toolbox to help provide a good clinical anesthesia state for the patient. And so if we can do a regional anesthetic, for example, a nerve block, that might allow us to decrease the dose of other medications. So I think, broadly speaking, in broad strokes, the best practice would be to continue the outstanding clinical management that pediatric anesthesiologists provide every day, while being open to other techniques, other modalities, if you will, that might allow us to have a multimodal approach is one of the terms that we use, so that we can make the dosing as reasonable and as safe as possible.
So let's talk about dose. I would imagine that weight of the infant might matter. What are the factors that influence dose?
You're absolutely right, Dr. Latimer. Everything that we give in pediatric anesthesiology is dosed very carefully on a unit per weight basis. So milligrams per kilogram, for example, micrograms per kilogram as another example. And then we also dose things based on age. We know that there are differences in the physiology, differences in the way the drugs act, the pharmacology, and the dynamics that vary by age. And so, with this knowledge that we have from our training and from our medical studies, we have an approach with which we dose the medications. The work that we're doing now actually, hopefully, will be helpful in further clarifying dosages and the understanding of what anesthetic effects are at the end organ that we're very, very interested in, which is the brain. And so this brainwave data that we had started to talk about, hopefully the other application is to just allow us to increase our understanding of different age-related effects of the medications that we use. And so the field is ever evolving, and we're constantly trying to push the envelope. And I'm privileged and grateful for the opportunity to try to do that on a day-to-day basis in my practice.
Sure. What
Yeah.
about so I would imagine that if an infant, your average age is 7 months, and many of them are premature, my presumption would be that there is considerable variation in number of procedures needed. Is there any data, or as part of your examination, the number of times that a procedure is undertaken? Because if a 7-month-old has one procedure, that might be different on cognitive development than if they had 7.
Absolutely. The number of exposures, and what you're definitely getting at, Dr. Latimer, is the confounding that occurs, right, by condition, is a very important consideration in any research study, much less a study of outcomes on cognitive outcomes, any outcomes in young infants. And so, absolutely, if a child needs anesthesia multiple times, that suggests that there's something that's very compelling from a health perspective that's requiring those numbers of anesthetics. And that could be very different, meaningfully, clinically, from an infant that requires a one-time anesthetic and is otherwise healthy for, say, a hernia or an extra digit on the finger. That's another type of surgery that we do. And so, yes, we are absolutely needing to distinguish infants and children that, I guess, in essence, are sicker or have more medical issues that require anesthesia, to look at those separately from infants that kind of have just a one-time anesthetic as a one-off. And in our study design, in order to minimize this kind of confounding, which you bring up, we are limiting our studies at this time to just otherwise relatively healthy children with surgeries that are anticipated, hopefully, to be just 1 or maybe 2 surgeries at most.
Sure. And so just with a few seconds left in our first half of the segment, how does your work control for or look at, if you will, the health status of your patient, meaning their vulnerability, and how that might, interface with the effect of the procedure?
We are doing a prospective observational style or type of study. And so we are definitely not able to control for all confounders in the way that, say, a randomized control trial might be able to.
Sure, sure.
And by nature of the observational study, there are definitely going to be some important confounders. Some of the techniques are just with our inclusion criteria, study design, and then with adjustments using various regression and statistical methodologies when we look at the data. That's one of the ways that we try to control for the confounding.
Sure. Incredibly important work, obviously, and work that, of course, needs to be done to ensure safety while enabling infants to have the critically important surgeries that they need. We're going to take a quick break. When we come back, Dr. Jerry Chao is going to tell us a little bit about his academic journey and life journey, and how that set the table for the exceptional work that he's doing to help children and infants today. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at bronxnet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Jerry, in this part of the segment, I always open with the exact same question, which is, where were you born and what were some of your formative experiences?
I was born in Taiwan, in Taipei, Taiwan, and emigrated with my mom and dad when I was about 2 years old. And I grew up in Queens, in Flushing, in New York City. And very, very grateful for my parents, the sacrifices that they made as first-generation immigrants, and their focus and dedication to my development, to my growth, and super grateful for all of the shaping experiences that I have and continue to have as the son of first-generation immigrants and as a beneficiary of their example. One of the biggest lessons that they taught me was the value of work ethic and the importance of seeking education. My mom and dad always said, nobody can take away your education. Nobody can take away what you've learned. And I've truly appreciated that and taken that guidance to heart. And it's really true. What you learn, what you gain, as far as whether it's book knowledge, whether it's experiences, something that you're apprenticing in, those experiences become your own unique experiences that you can process, that you can develop within yourself, and that you can ultimately apply to all other aspects of life, whether professionally or in your personal life with your relationships with family, friends, loved ones. And so truly, it's about looking at each and every day with a sense of curiosity, with a sense of wanting to do something to better yourself, to better oneself, and by extension, those around you, the people around you, your community. As a clinician, I've chosen a specific route in my life and in my life journey, which we can talk about more or not. But yeah, those are some of the elements of my origin story, if you will.
Yeah, that's wonderful. So you grew up in Queens. Where did you do your K through 12?
So I went to New York City public schools. I'm a very, very proud New York City product. So I went to Public School 24, the Andrew Jackson School in Queens and Flushing, which unfortunately, the namesake, there are some elements of Andrew Jackson that are both positive and negative, but that's true with many figures in history, I guess. And then I went to Intermediate School 237, which was right across the street, the Rachel Carson School. And she is, of course, a phenomenal researcher, a powerful public figure, a woman who educated the masses about the dangers of pesticide and about environmental exposures. And then I went on to attend high school at Stuyvesant High School, which I'm tremendously grateful for the opportunities. It was tremendous shaping experiences, the privilege of attending high school there. And I'm forever grateful for my education there, which helped me prepare for undergraduate and graduate school. And of course, all of my teachers and all of the people that helped shape me when I was in elementary and middle school too.
So a proud product of K through 12 public school at NYC. Sure. I'm sure that they are equally proud to have you as one of their successful sons. Where did you undergrad?
I ended up attending Brown University in Providence, Rhode Island.
Yep. And
I can't believe it, Dr. Latimer. This year, it's my 20th college reunion. I'm starting to feel maybe a little old now, relatively speaking, I guess, And so this Memorial Day weekend, I'm taking my wife and my 3 children back to Providence, and to enjoy and to celebrate and reunite with some of my classmates.
Well, that's so great. That's wonderful. Providence is a great town.
Yeah.
Brown is a great school. What was your undergrad major?
I was a neuroscience concentrator. It's sort of like a biology degree, but kind of like a glorified brain focused biology degree. So it's funny how life kind of comes full circle. I was always fascinated and interested in the brain, always trying to understand and just curious about why it is that I'm able to speak with you now, why I'm able to hear what you're saying, understand the words that you're saying, formulate thoughts, and then, speak, move my mouth, and speak in a way using language that I've learned, over the years in my life. So that always fascinated me. What was truly exceptional about my education at Brown was its open nature. There's an open curriculum that Brown University is famous for, and it really allowed me to formulate and cobble, if you will, my own course of study, focusing, yes, on brain sciences, but also studying the humanities and studying other elements as well. And the ability to think about and craft one's own education, that was really, really hard, really, really challenging. But the process of doing that was so rewarding because it challenges you. It challenges one to take accountability and ownership for one's education. And how does an 18-year-old do that, right? Well, by making plenty of mistakes, lots of learning, and Brown encourages that. And that's truly a model for life. We are always learning, we are always growing, and every day is a path towards getting better.
And during your time at Brown, were you the open curriculum sounds excellent and a great summary and testament to it that you defined. Did you have experiential learning opportunities, or did you work in labs at the undergrad level, or did that come later?
Definitely. I had experiences in undergrad and also in high school as well, upon which I built when I was in undergrad. And so as a part of my high school training, it used to be called Westinghouse. Now it's called the Intel Talent Search, Science Talent Search. That's where I started my first exposures in research. And so I worked at the Public Health Research Institute right across the street from Bellevue when I was in high school. Studying bacteria, studying E. coli bacteria and antibiotic resistance. My amazing mentor, Dr. Carl Drullica, was one of the giants in my early development. And then at Brown, yes, I also had an opportunity to engage in more research activities and in neuroscience at that point, learning how to do behavioral studies in rodents, in a rodent model, looking at synaptic plasticity in the brain, if you will, which is basically how the brain develops and changes over time. Those were some of my early defining experiences that kind of set the stage for my choices in medical school, what I gravitated towards, what really spoke and resonated with me intellectually, what kind of stoked that fire, that passion in me to do research, and my clinical practice today.
Wonderful. Great summary. And again, a testimony to experiential learning opportunities and, getting into the field to augment the more formal coursework. So you finish at Brown. Was your next step medical school? And if so, where did you attend?
Yes, the next step was medical school. I had the privilege of applying and then being accepted and going straight out of my undergraduate schooling, which is both a positive and a negative. I think at some point one has to gain life experiences, and I was very privileged and grateful. I received outstanding training at Mount Sinai as a medical student and as a resident in anesthesiology. And during that time, it truly was, I felt like I was kind of drinking water out of a fire hose. I was learning all of this medicine, all of this physiology, everything in medical school, and then really kind of trying to level up too in terms of my life experiences, my awareness of life. What does a 22-year-old straight from college, what does somebody like that understand about a middle-aged person who has a new cancer diagnosis, or a young mother, who just lost her child because of tough circumstances in life. So those are some of the shaping experiences going into the clinic that I found myself really working very hard, opening my mind and heart to grapple with, to wrangle with, because life is so broad. The breadth and depth of life experience, as I often discuss with students at Albert Einstein College of Medicine, it's one of the most privileged things that we do in medical training, and it could also be tremendously challenging and difficult. And so I found myself during medical school and in residency engaged in the privileged hard work of transforming myself to become a medical professional, somebody who is capable of taking care of people that have important health conditions that are coming that require our help. And so I had a fantastic, phenomenal experience training at Mount Sinai.
And what factors led you to choose the area of specialization that you ultimately landed in?
It was a combination of a lot of factors: my intellectual interests, the time and the phase and the point, I guess, so to speak, that I personally was at in my development. When I speak and counsel medical students, I often say the choice of a specialty, I guess. It's kind of like falling in love, so to speak. It's about meeting the right person at the right place at the right time. So that kind of gives a little bit of a flavor for my process. It certainly was not predefined, and I thought that I was indeed going to be a neurologist, somebody who studies the brain and the central nervous system, and a clinician involved in the field of neurology. But I learned as I was going through my rotations that there were certain areas as well that I gravitated to. I found myself fascinated by procedures, by intervention. So I also considered surgery. So I was sort of all over the map. And going back to that analogy, of falling in love, so to speak, I was fortunate to meet a giant in my life, Dr. Stephen Newstein. He was the mentor that I needed at Mount Sinai, and he's still there now practicing, and we keep in touch. Dr. Newstein, he was the right person at the right time, at the right place for who Jerry Chao was at that time. And he truly gave me a phenomenal exposure and experience in the field of anesthesiology and allowed me to visualize and truly believe in my mind and in my heart that I could be a clinician in that field, that I could be an anesthesiologist. And so I credit him tremendously with my development.
So clearly, a theme throughout your excellent career and work in education is the critical importance of mentors. I want to thank Dr. Jerry Chao for joining us today and sharing his excellent journey and the great work that he's doing. I want to thank the viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. See you next time. Stay safe. Take care.